Thanks, Brandon. Well, the CDC recently stated that 40% of fully vaccinated Americans had received their booster shots. And according to the Associated Press Center for Public Affairs, people are more likely to see the initial vaccinations rather than a booster as essential. 23 ABC's Brianna Polk joining us now in East Bakersfield with insights on Kern County's booster administered rates and how some people are impacted by this vaccine. Brianna.
Public Health stated that it is important to note that not everybody is eligible to receive their booster shot. The booster shot is authorized for those who are 16 years of age or older and, of course, are fully vaccinated. Now, with the ever-changing information that people receive, it has caused challenges for some people as to why they haven't received their booster shot.
It's multifactorial. I mean, people are really tired of just of the pandemic, of getting the shot. Second thing is that this Omicron variant did not have the same susceptibility to the immune system, which is induced by the vaccine, as the Delta variant and the Alpha variant.
Dr. Jamaluddin, medical advisor of Adventist Health, adds although we have seen variants of the virus, the efficacy of the COVID-19 booster is still present.
However, we have to be careful here because it doesn't mean that the efficacy of the vaccine is not there. It is effective. With time, the vaccine efficacy or the immune system will become down. And then we have a new variant, which is not as susceptible to the antibodies that is produced by the vaccine.
He adds that many folks have underlying conditions, and that is one of the many reasons why people are reluctant to getting their booster shot and why the administration of booster rates are not currently at its peak here in Kern County.
Our patient here in community is vulnerable from health metrics. We have our health metrics in terms of like obesity or hypertension and diabetes, is not the best. Actually, there is a vulnerability index that is looked at in various counties in California, and we are considered in this vulnerability index very vulnerable population, very vulnerable community.
According to the Kern County Department of Public Health, 50% of Kern's total population is fully vaccinated against COVID-19. And as of Sunday, 36% of Kern County's fully vaccinated population has been boosted. With the hopes of these rates increasing, Dr. Jamaluddin adds that there is still a specific group that is getting impacted.
Healthcare workers, our workforce, we really, even if they don't get severely ill, when they get ill and have to leave work, it affects, our ability to deliver care for everyone, not only the people who have COVID, but also for people who are suffering from other conditions.
Michelle Corson of Public Health did state that they did see an increase of booster doses during the last week of September 2021 and that those numbers have relatively stayed the same on into the new year of 2022. Live in East Bakersfield, Brianna Polk, 23 ABC News, connecting you.